I feel greatly honored and privileged, as I said, to be here and give this keynote address. Since it's the keynote address which was supposed to come from the President, I will stick to what he was supposed to say as much as possible. The address is on the theme of feeding the 9 billion, leveraging healthy, sustainable diets for climate mitigation, environmental protection, and public health benefits. I am pleased to share with you the Malawi success story on leadership and collaboration across the sectors for more sustainable nutritional practices. Ladies and gentlemen, Malawi has made considerable gains in child survival and maternal health. The gains have translated into decline in underweight and chronic undernutrition. For instance, underweight from 24% in 1992 to 13% in 2010. Stunting from 56% in 1992 to 47% in 2010. However, recent nutrition surveys have shown a further decline to around 42%. Anemia from 80% in 2001 to 52% in 2009 among children aged 0 to 2 years. In women of reproductive age groups, anemia has declined from 47% in 2001 to 29% in 2010. Increased proportion of mothers who are exclusively breastfeeding from 53% in 2004 to 71% in 2010. Community-based management of acute malnutrition was established and contributed to the reduction of death related to malnutrition by 90%. Ladies and gentlemen, despite registering improvements, the figures are still very high and frightening. It is therefore against this background that the government of Malawi included the prevention and management of nutrition disorders, HIV and AIDS, in the Malawi Growth and Development Strategy 1 as one of the priority areas for national development. To ensure continued commitment, Malawi has also included nutrition, climate change, and food security as priority areas for economic growth, as provided for in our Malawi Growth and Development Strategy 2. Ladies and gentlemen, Malawi has experienced food insecurity mostly due to climate change that has significantly reduced production access. The effects of climate change are very worrisome because Malawi is one of the countries with the highest levels of undernutrition in the world, especially stunting. The government of Malawi is committed to address both food and nutrition security through the scaling up of nutrition and farm input subsidy programs. Ladies and gentlemen, realizing that nutrition is a cross-cutting issue which requires multi-sectoral approach, the government of Malawi has established the Department of Nutrition, HIV and AIDS to coordinate nutrition by providing policy direction, guidance, oversight, creation of implementation structures, and high-level advocacy. The government has developed the National Nutrition Policy and Strategic Plan to guide the implementation of nutrition activities in the country in a coordinated manner, and has integrated in the key sectoral ministries, mainly Ministry of Education, Agriculture, Health, Local Government, Gender and Information, Culture and Tourism. Nutrition has been positioned at the center of the development agenda as a stepping stone for the attainment of adequate nutrition and greater participation of all the stakeholders. Ladies and gentlemen, I'm prepared to sustain the political commitment, that is, of the government, and the gains, that is, the government of Malawi. The government has introduced a nutrition vote in Parliament and has put in place implementation structures to support the nutrition support, such as cabinet, parliamentary and principal secretaries, committees on nutrition, HIV/AIDS, National Nutrition Committee, Government and Development Partners Committee, as well as public and private sector partnership, civil society network on nutrition, and district nutrition coordination committees. Ladies and gentlemen, the government of Malawi has also intensified the school health and nutrition program, which has benefited 3.2 million pupils who are receiving micronutrients, supplementation, and skills for optimal nutrition practices in almost all public primary schools. Additionally, 1.1 million pupils in 1,172 public schools have benefited from the school feeding programs where children are given a meal every day. Enrollment rate has increased and absenteeism among the pupils has reduced. The government is also scaling up the school feeding program in all the public schools. Ladies and gentlemen, Malawi has also intensified nutrition programs aimed at reducing macronutrient deficiency disorders such as vitamin A, iron, and iodine. The programs include vitamin A supplementation, dietary diversification, biofortification, and fortification of some of the centrally processed foods such as cooking oil, sugar, wheat, and maize flour, among others. Ladies and gentlemen, in management of malnutrition, the government of Malawi is promoting the use of locally produced therapeutic and supplementary foods to maximize the production and value chains additions. Community-based management of malnutrition has been scaled up in all the districts to ensure timeless access, coverage, and early case detection. The services, ladies and gentlemen, have contributed to the reduction of malnutrition and mortality rate related to malnutrition among children. Ladies and gentlemen, our nutrition interventions, which are being scaled down, include promotion of recommended practices that supports maternal nutrition and infant and young child feeding and care, improved macronutrient intake, women empowerment, such as promotion of rice-based approaches for communities to demand nutritional services, as well as promotion of community involvement and participation, such as political, faith, and traditional leaders, academia, and research institutions. Additionally, the government of Malawi is also scaling up the implementation of nutrition-sensitive programs such as agriculture subsidy program, diversification of crops, and use of early maturing crops, among others. Ladies and gentlemen, to ensure accountability in the nutrition response, the government of Malawi has developed the multi-sectoral resource tracking tools, the National Nutrition Monitoring and Evaluation Plan, with well-defined targets which have been rolled out in all the districts. Despite registering some notable achievements, there are still a number of challenges in nutrition, such as inadequate financial and human resources to support national programs. We are therefore pleased to hear that in Addis Ababa, as it has been reported here, that there will be this meeting in which I'm sure that it will attract some donors to inject some funding in this particular field in order that perhaps countries like Malawi can benefit. Another challenge has been inadequate community frontline workers and the capacity at community level to track and follow up the caregivers at the community level. There has also been a challenge of low community and male participation in the national nutrition response. Not forgetting the problem of women empowerment is very critical for sustainable food and nutrition security. Let me take this opportunity to thank you very much for inviting Malawi to this important session to make this keynote address Of course, I could have gone on and on, but I've taken into account with a 7-minute limitation. And I'm glad that with the time available and the delegation which I've been given, I had to stick to the North. But I have benefited much, and the delegation which is here for Malawi has benefited. And we thank you all. Thank you very much.